Today a large proportion of the female population is affected by polycystic ovarian syndrome or disease. That means that they have ovarian cysts, which are usually harmless and of various sizes. The cysts are small fluid-filled sacs that are located within or on the surface of the ovaries. They are typically caused by hormonal fluctuations, and can develop at any time during your reproductive years. Although they're not a serious health problem, it's important that they be detected in a timely manner to prevent further growth. A number of physical symptoms are key to detection, but other symptoms could also indicate the presence of cysts on the ovaries. 1. Changes in urination. Any change in your urinary habits could be a sign that you have various health problems. If you suddenly feel the need to urinate and even you can't control it, keep this in mind because it could be due to ovarian cysts. These symptoms, as well as burning after urination, indicate that your pelvic floor muscles are weakened or infected. If the problem persists for more than a couple of days, it's best to consult your doctor for early diagnosis. 2. Abnormal bleeding. One of the most obvious symptoms of a hormonal problem is spotting that occurs in between your normal periods. Although it's common for most women to experience this occasionally, if it's happening on a regular basis it's best to visit your gynecologist. 3. Pain during intercourse. Vaginal infections and inflammation are primary reasons why some women experience pain during sexual intercourse. But if the problem becomes so persistent that it affects your normal sex life, you need to see a specialist to rule out any other possibilities. 4. Vomiting and nausea. Vomiting and nausea aren't just symptoms that pregnant women experience. Hormonal imbalances that cause ovarian cysts can also trigger these symptoms in women who aren't pregnant. 5. Abdominal swelling. This is a symptom that's often ignored because it's commonly triggered by other factors. Distension or swelling of the abdominal area is frustrating and can also be accompanied by pain. If you're suffering from it on a regular basis and don't find relief in a few days, it's a sign that something could be wrong. 6. Pain in the lower back. A feeling of tightness or pain in the lower back doesn't always indicate that you have a muscle problem. Sometimes the cause requires a deeper assessment, as it could be a kidney infection or a reproductive system disorder. 7. Sudden weight gain or loss. Sudden weight loss might seem like a blessing for someone who is overweight or obese. But if you're not making the effort to achieve it, it's best to consider it with caution because something could be wrong. The same thing goes for sudden weight gain, especially when you're keeping an otherwise healthy lifestyle and diet at the time. A loss of appetite or eating too much due to anxiety are signs that you should carefully consider as potential indicators of disease. 8. Constant fatigue. Stress, having a poor diet, and being overworked are the most common factors that trigger bouts of fatigue. Hormonal imbalances, however, can also give rise to continuous or chronic fatigue. If you feel like you don't have any energy, you're tired, or having trouble concentrating, you should consider the possibility of ovarian cysts. 9. Pelvic pain. Pain in the pelvic region is a very important sign of polycystic ovarian syndrome. If it's occurring outside of your normal period, it's a good reason to talk to your doctor. All of the symptoms we listed above can occur in different ways, depending on the case. Sometimes they may be accompanied with changes in your bowel movements or even moods. If your cysts don't cause any complications, it's still a good idea to keep track of them and have a thorough exam in case they could become problematic.